In medicine, getting the name right is everything. But what happens when one single name points to three totally different, completely unrelated conditions? Well, that's the puzzle we're digging into today. The very curious case of the Weber syndromes. It sounds like a riddle, right? On the surface, they have absolutely nothing in common. One's a brain attack, one's a congenital vascular problem, and one's a disorder that affects the skin and the brain. And yet, somehow, they all share the name Weber. How is that even possible? And more importantly, how did doctors tell them apart? So to get to the bottom of this, here's our plan. We're going to untangle this Weber name game. We'll break down each syndrome one by one, the midbrain stroke, the one with that port wine stain, and the vascular disorder. Then we'll put them head to head, and finally, we'll reveal the surprising reason this whole medical mix-up exists in the first place.
All right, let's officially start untangling this knot.
You know, it's a classic case of mistaken identity. But in the medical world, this kind of confusion can have some really serious consequences. So our mission here is to give each Weber its own unique identity, so you can see exactly why they're so incredibly different. Let's start with the first one, and probably the most neurologically complex of the three. This is the one that's actually called simply Weber syndrome. And this story begins deep, deep inside the brainstem. So Weber syndrome is a type of stroke. It's caused by a lesion, usually an infarct, from a blocked artery, in a very, very specific part of the midbrain. The key takeaway here is this isn't something you're born with. This is an acquired injury to the brain. And check this out. This MRI scan shows you exactly what's going on. You can see that bright ring-enhancing spot right there in the left side of the midbrain. That tiny area of damage, that's the epicenter of all the symptoms we see in Weber syndrome. Okay, now to really understand Weber syndrome, you have to get this idea of crossed deficits. This is the absolute key to identifying it. Because of where that lesion is, it hits some nerve pathways before they cross to the other side of the body, and others after they cross. This creates this really specific and very telling pattern of symptoms. So here's what that actually looks like. On the very same side as the brain lesion, that's what we call ipsilateral, you get a third nerve palsy. This nerve controls most of the muscles that move your eye. So when it gets knocked out, the eye kind of drifts down and out. You also get a drooping eyelid, which is called ptosis. But then, and here's the crossed part, on the opposite side of the body, what we call contralateral, the patient gets hemiplegia. That's weakness or even paralysis of their arm and leg. And you can see that classic presentation right here. This patient has a lesion on the left side of their midbrain. Just look at their left eye. See that drooping eyelid? And notice how the eye itself is pointing down and away? That, plus weakness on the right side of their body, is the textbook sign of Weber syndrome. Okay, let's move on to our next Weber. All right, we're gonna completely switch gears now. Forget everything about strokes. Our second condition, Sturge-Weber syndrome, is a congenital disorder. That means you're born with it, and its most famous feature is usually right there on the face. The keywords here are congenital, neurocutaneous, and gene mutation. So unlike that stroke we just talked about, Sturge-Weber is caused by a gene mutation, specifically in the GNAQ gene that happens super early in development. It's not inherited, and it affects both the skin, the cutaneous part, and the brain, the neuro part. So what does this actually look like in a person? The hallmark sign is that facial port wine stain, which is a type of birthmark, but that's just what you see on the outside. On the same side of the head, there are also abnormal blood vessels on the surface of the brain. And these can cause a whole host of issues, with seizures being the #1 most common symptom. Patients also have a really high risk for glaucoma in the eye on the same side as the birthmark. And now for our third and final Weber. Parkes-Weber syndrome. Again, this is a congenital condition, but its focus is totally different. This one is all about the body's vascular system. It's plumbing, if you will. Parkes-Weber is also something you're born with, and sometimes it's linked to a mutation in a different gene called RASA1. It causes malformations in the blood vessels themselves, the arteries, the veins, the capillaries, the whole shebang. Its most dramatic feature is something called hypertrophy. That's the overgrowth of a limb. So one arm or one leg might be way bigger than the other. This is caused by abnormal blood flow from things like arteriovenous malformations, or AVMs, which are basically faulty shortcuts between arteries and veins. Patients might also have varicose veins and skin stains that can look a little bit like the port wine stains we saw in Sturge-Weber. Okay, we've met our three contenders. Now it's time for the showdown. Let's put them side by side to make these differences crystal clear, and finally untangle this knot for good. And here it is, all laid out. Just look at the difference. Weber syndrome, a stroke in the midbrain. Sturge-Weber, a genetic mutation affecting the face and brain. And Parkes-Weber, a vascular problem causing a limb to overgrow. We're talking completely different causes, different affected areas, different symptoms. But take a look at that last row. Notice anything interesting about the names? That's the final piece of our puzzle. And here's the answer. The entire mix-up, it comes down to a father and son. Sir Hermann David Weber was the physician who first described that midbrain stroke way back in 1863, and his son, Frederick Parkes Weber, also a doctor, went on to describe the other two conditions. That's it. A simple family connection created more than a century of medical confusion. Amazing, right? So we've solved the mystery. But beyond being a really cool piece of medical trivia, there's a critical, life-or-death reason why getting these names right is so incredibly important. I mean, just think about it for a second. Mistaking one of these for another could be absolutely disastrous. A patient with Weber syndrome needs emergency, time-sensitive treatment for a stroke right now. A family dealing with Sturge-Weber or Parkes-Weber, they need genetic counseling and a long-term plan to manage things like seizures or vascular issues. The diagnosis dictates the entire path of care. It's everything. This whole case really makes you think, doesn't it? Naming conditions after people, we call them eponyms, it's a long-standing tradition in medicine that honors the pioneers. But, as we've just seen with the Webers, it can also lay some pretty confusing traps for future generations. It really begs the question, in the quest for absolute clarity, what's really in a name?